Welcome to First Things First. I'm Brooke Blurt and my pronouns are she and her.
I'm Matty Mills, my pronouns are he and him, and before we get started, we'd like to acknowledge the custodians of the land on which we record. For me today, that's the Gadigal People of the Eora Nation.
And for me, it's the Wurundjeri people of the Kulin Nation. This episode will discuss a combination of women's business and men's business relating to sexual health. Are you ready? Let's go. So you might remember a few weeks ago we had an episode discussing STIs and overall sexual health. And we put it out to our socials to see if anyone had any questions, STI stuff, like they just wanted to ask. Okay, so joining us in studio today is Cara Taheny to shed some light on some of those questions that we've spoken about around STIs. Cara, hello, how are you?
Hello, thanks for having me. I'd just like to start by acknowledging the Gadigal People of the Eora Nation that I'm on their lands today, so I'm calling in from Perth.
Oh, my home country.
Oh,
It's pretty gorgeous.
Talking about something that we have had on our books for a while, actually. Having more open line conversations about this topic. I guess we don't really speak about STIs. We're a bit shame. In our community, we'll say shame. But we say that we would love to, break down these walls and, making sure that we're creating spaces that are safe and conversations that are, open. And I think this has probably been one of our topics that people have shown a little bit of interest in.
We thank you so much for coming on the episode to raise awareness around this. It's, often a taboo topic, but today we are leaving that at the door. There's no shame here. We're going to ask all the questions that everyone wants to know. Can you tell us a little bit about your work as a sexual health nurse and what you love about it?
Yeah, so I've been working in sexual reproductive health for 16 years. I've worked across the country, so worked in Adelaide, Perth, in central west New South Wales. I've also worked in the Kimberley up in Kununurra, and I've worked at Ngarrindjara, which is where Brooke has worked for the same mob before. So we've worked there.
Oh, I didn't know that.
Yeah, I think our times might not have aligned, but I'm really passionate about what I do, so passionate that I did my master's degree so I could become a nurse practitioner. And so there's not many nurse practitioners in Australia. I think there's about 2,500. And obviously they're all in different specialties, mine's sexual health. And that just means that I have the knowledge and skills and training to be able to diagnose and treat people. And, we're the most senior independent clinical nurses in our healthcare system. And then also I do a lot of women's health. So I do a lot of contraception and period stuff and menopause and just all aspects. I love it. I love that I can provide safe spaces for people to have a chat and see that difference of someone coming in, yes, very shame and awkward, and walking out really proud and empowered and knowing that it wasn't as scary as they thought.
Deadly.
I think we have like a list of questions here that we'd love to run through. But before we do, can I ask what has changed in terms of the landscape that you're working in for sexual health over the years? You've got a lot of experience there. What have you seen that has changed from when you started to now?
Yeah, so I think from when I started, I felt like sexual health was always a woman's problem. In my clinics, it used to be always seeing women. And I think over time, I see more men. Men are presenting, men are coming in. There's a lot more normalisation of men seeing me. I also do a lot of gay men and men who have sex with men, sexual health. So I do a lot in that aspect. So that's definitely seeing men. STI-wise, across the board, it's probably always been fairly similar. But syphilis has been the big problem that we've seen. So when I started 16 years ago, all of us as clinicians were told, don't worry about syphilis, don't let that be on your radar because you won't see it. Wow. Now it's a massive problem across the whole of Australia and in particular First Nations people. Yep. And that's been quite significant because that's resulting in women losing their babies in Australia, which is a privileged country. So we're not doing enough as a workforce and as a system. But we also need to provide safe spaces for people to come and test with us. So syphilis would be the big change, I think, that I've seen in the last, decade.
Mm-hmm. Yeah, wow. I guess with talking about the percentage of syphilis being really high, and especially in First Nations people. Like, why is that?
So to give context, so they reckon 1 in 6 people in Australia in their lifetime will get a STI. So STIs are actually more common than we probably think. That's about 4 million people in this country. If you look at the actual data, you'll see I had some data from 2021 where chlamydia, for instance, is about 90,000 cases a year. Gonorrhea was about 27,000. Syphilis was around 6,000. So it's not the, number one, and it's lots. Yeah. But the problem with syphilis is it gets picked up on a blood test, and it's also, when you look at First Nations data, the Kirby Institute put out information in 2022 that when you look at those statistics of STIs, gonorrhea in First Nations people is 6 times more likely than in a non-Indigenous person. Wow. Syphilis is 5 times higher, and chlamydia is 3 times higher. So it's a fail across the board.
Yeah.
And there's lots of reasons that STIs are more common in certain populations. So if I look at my gay men's health and working with the gay community, STIs will be higher in that group, but that's because the pool of men that you have choices to have sex with is smaller compared to the rest of Australia. And so when you look at Indigenous numbers, there is that as well, but you can't deny how much more we're seeing it in these people. And I think it's a lot to do with all the factors we know that make us less likely to engage in healthcare. So not being able to trust systems and trust places to go to, and having some negative thought processes about the places we go to for healthcare. Also, education, housing, poverty, just basic everyday stuff that we take for granted. There's people out there that don't have access to those things. And when you don't have access to all of those things in your life, getting an STI test is not on top of your list. And so there's lots of reasons, I think, that feed into that. And that's not a First Nations problem. That's, people that I work with that are homeless and IV drug users or mental health issues. And then there was a syphilis outbreak that did start over in Queensland years ago. And unfortunately, it probably wasn't managed as well as it could have been. And what's happened with that is we've seen, with the transient populations that we can see, people move around. And if we're not testing, because most of the time syphilis, you won't know that you have it. And what happened is it did pass through, and we're now seeing it in every state. So it travelled across to Northern Territory, down to SA, across to WA. And so in First Nations populations, they're the people we need testing.
Well, yeah. I think that is quite surprising to me. I mean, I'm gay and First Nation, so it is a little bit surprising to me. But I think that, there's not enough conversations around it, and I'm glad that we're able to do that today. I would say one of the most common, things within sexual health to prevent an STI is wearing a condom. I want to ask this from a male perspective. Is it the men's responsibility when it comes to wearing a condom?
Yeah, good question. It's whoever's having sex, it's everyone's responsibility that's having sex to make sure a condom's being used. And that doesn't just start at the time that a condom's getting put on. It starts before that even happens, because sex should be about safety and respect. And so it should be normalized to say, hey, have we got a condom? We're going to use a condom. When was your last STI test? Those are the sort of normal conversations that should be happening in any sexual relationship.
I have another question. Does the pill stop any STIs?
Unfortunately not. So a lot of people do think that sometimes the contraception that we use to prevent pregnancy can also help with preventing STIs. But all the contraceptives, so pills, intrauterine devices, implantons, those sort of things, they'll only prevent a pregnancy. A condom's the only one that will prevent an STI and a pregnancy. So even if someone's using contraception, always remembering that condoms is what's going to prevent your STIs.
As a gay man, I know that, I do get regular checkups, even though I'm in a relationship. What happens during an STI check? Can you sort of run us through the process?
Yeah, so with an STI check, it's usually fairly basic. It does depend who you're seeing. So I work in sexual health, and all the sexual health clinics around Australia, that's their work and core business. So they'll probably ask a few more questions than a GP might, or a nursing community. But when you look at testing, you don't have to be examined. I think a lot of people panic and think they're going to have to lay on an examination bed and someone has to look at their genitals and those sort of things. And that's not true. Yes, there's certain circumstances that I'll do that, but that's always in negotiation and there's always a workaround. So with testing, for most people, it's a blood test because we usually want to look at HIV and syphilis. We may also look at hepatitis A, hepatitis B, and hepatitis C, depending on risk factors. And then also with your testing for chlamydia and gonorrhea, for most people, that would be a urine test. And then usually for women, I'd always recommend a vaginal swab instead of a urine, just because it's got a better pickup rate. And then for men, urine test. And depending on the sex you're having, it might also be a throat swab or a anal swab that you can self-collect. So you can do that in the bathroom.
Matty and I both work in TV, so we often have to get medicals done. And I mean, I have never had so many STI checks because of the industry. But I'm, grateful because I also do have like a blood disorder. So I occasionally have to go get bloods often. And even if I am not doing any TV and I'm getting my bloods done, I just do a regular check as well. How often should you just be getting a checkup if you have unprotected sex, or should you be getting regular checks regardless, even in being in a relationship?
I think the way the current landscape is I think everyone should be getting tested. So it doesn't matter if you're single, if you've had 3 partners, 1 partner in the last 3 months, or 100, or you've had the same partner for 15 years. When I offer women's health checks, for instance, and I'm doing a cervical screen, part of that is offering an opportunistic STI test. And that might be to someone that hasn't changed sexual partners. For me, the message is you're in charge of your own body and your health. And I think we can be in relationships. And of course, I'm in a relationship. I trust the partner I'm with, but it's still normalized in our relationship that you do get a test when you've been offered one or when you think you might need one. And I've had mates that have, had GPs question that when they've been together for a long time and they thought they better get tested before they have kids, for instance. But they were like, no, that's just part of our looking after our health. We want to make sure everything's healthy before we get pregnant. And I think with syphilis, everyone should be testing every year at least. For some people, I see it's every 3 months. It might be every 6 months, but it needs to be normalised. Doesn't matter who you are and who you're with.
Yeah, we're talking about testing, but I wanted to know about treatment. I know that not all STIs are able to be treated. When it comes to that, are most STIs able to be treated? I know that some aren't.
Yeah, so most of the ones we see we can cure. So there's antibiotics people can take, and that might be tablets or an injection, depending on where you live and what the infection is. So chlamydia, gonorrhea, syphilis, all treatable. So even if you're pregnant and you have syphilis, it's treatable. The sooner you're tested, the better. So that's important for people to know. It doesn't mean something bad's going to happen. It just means you need to have your treatment. So yes, there's things like HIV and herpes that we don't have cures for, but we manage HIV so well now. Like I see patients and clients that you wouldn't even know they have HIV. I've got mates with HIV. You take one tablet a day, just like you're taking a blood pressure tablet, and you'll live probably longer than me, to be honest. It depends on what else is happening in your life. But yeah, most of the things we see, we can sort out. And I think people don't need to be scared about that. And when you get tested, we often talk about what that means if a result comes back, what we'll do for you to help.
So herpes is one that you have to take medication for?
Not necessarily. So herpes, there's 2 different types. So there's type 1 and type 2. And type 1's the common one that a lot of us have, which is cold sores, but most of us will kick off coming into winter now. So a lot of us have that. And I've never seen stigma around that. So it's not like you're out somewhere and you're about to hash on with someone and you're like, hang on, can I just check, do you have cold sores before we kiss? No one thinks twice. And cold sores, as we know, most people will get them maybe once a year. It might be last there for 7 to 10 days and then it's gone. There are medicines that can reduce your symptoms. So yes, you're right. People will be like, oh my gosh, it's starting to kick off. I'm going to go take some tablets and that will make it go quicker. We can get type 1, the cold sore virus, on our genitals through oral sex. We also get type 2, which is the one that does like living on the genital area. So there is so much shame and stigma with genital herpes. People can get really anxious and wound up about it. But again, people can take medicine. So a lot of people over time, the gaps between outbreaks, as well as the severity of the outbreak, gets less and less.
Well, you've mentioned that there are some symptoms for certain STIs, but in some STIs, you don't really have symptoms. What are some things you can look out for that might inspire you to go get tested?
Yeah, so some people, it might be swelling or itching or a rash on the genitals or the surrounding area. Some people get lumps, bumps, ulcers, things like that, that you think, well, this isn't my normal. And in that regard, I always encourage people to get swabbed as soon as those symptoms are there, because if you wait 2 weeks when you got your doctor's appointment booked in, they'll be gone. And then I can't swab anything if it's not there.
Yeah.
Some people can get urethral discharge from the vagina, penis, anal area. You can get discharges that are unusual. And that's unusual in women compared to normal discharge, because vaginal discharge is normal. And then some people might get skin changes. They might get pain when they're urinating, so it feels stingy. It could be pain with sex. And then in women as well, it could be that there's some abnormal bleeding happening. So it might be that you're an older woman that's gone through menopause and all of a sudden your period stopped 5 years ago, but you've had some bleeding in the last week. That's unusual and should get checked out. It might be bleeding between periods or bleeding after sex.
Testing isn't just for people who are having casual sex, but it's also for people in monogamous relationships. What's a good way that we can bring up the conversation with our partner if we feel like we'd like them to get tested or that you would like to do it together?
So what I really like is what we do in First Nations communities. So when I've been working remote, it's normal to have an annual health checkup, your adult health check. So I say to people, when was the last time you had your men's health checkup or your women's health checkup? It also includes your sexual health. So that should include those tests as well every year. And that doesn't matter who you are. At the end of the day, you know, you don't need to ask 20 questions about why you need one, who are you having sex with, I thought you were married, like all those questions.
Yeah.
It should just be so routine, just like we order a test to check people's iron.
I know, that's exactly it. That's why I kind of treat it like that as well, because I feel like I've had so many conversations with friends and family as well. Like I've had conversations with my younger brothers about, you know, when they were young and they were starting to have active sex. We don't have our mum around, so like I'm the next, you know, thing. And I guess my brother felt like comfortable enough to come to me and talk to me about it because he knew that I worked with kids and, you know, people of his age. So and I felt good about that, you know, feeling good that, you know, I've been able to create that safe space for him. But I could see the awkwardness and the feeling of like coming to your sister and being like, oh, like this is what's happened. I need to go to the doctor and I need my Medicare and all this sort of stuff to like, you know, so it's a huge thing, I guess, for young mob to break that like feeling of shame. And I feel for them because I once upon a time was there, but I guess, you know, when you grow into yourself, you become more comfortable about talking about sex. And I know that the department are working more about talking about consensual sex and
one of the things I remember talking about out in community was about having your 5 people. It was an activity you used to do. Who are your 5 people in your life that you can go to for anything? And, you know, you should be so proud that your brother could come to you. That's such a special thing. And that's what I really value in my work, that people see me in that light. Every state's a bit different, but we have like legal frameworks that support young people. Yeah. So there's a lot of misconceptions that you have to take your mum to your appointment. Yeah. You need your mum to get the pill, or you need your mum to get an STI test, or she's going to find out you've got chlamydia. That's not true. So yes, there are rules that if we're really worried about your safety and we think that something's, you know, you're going to get hurt or, you know, something big like that, of course we might need to talk to some people. Yeah. But in general, it's a confidential process, and some of the battle sometimes is advocating for people to know their rights and that you actually can go on your own. I also find taking a mate with you or a cousin or anyone, because often when you walk into the room, it's quite daunting. And all you need is a mate just to open the conversation, which is, oh, they're here for a test.
I mean, how do you search and find a GP who's friendly and understanding? Like, do you search, say you're a First Nations person or a queer person, like, do you recommend trying to find a GP that you respect?
So I know the government has a website, health.gov.au/STI. So on there, I used it last night. You can put your postcode in or your city and it will try and point you in the direction of services nearby. So for instance, sexual health clinics that are government run, there's sexual health clinics that used to be called family planning, some still are, but they are non-government organisations that do a lot of this work. So they're really safe places to go to. I see a lot of people where their GP might be the family GP or the GP that 3 generations have seen, or it's a GP that they don't want to know about their sexual health. And so sometimes people do want to separate that. So I want to keep my GP for some of that health stuff, and then I'll go to this clinic for something else. That's okay. It's about choices. Obviously, in community, you don't have choice. You've got whoever the nurses are that are working in the clinic at that time. And I've been out there, that can sometimes be hard. And the staff change a lot. And for a lot of people, building rapport is really important. And so really it's about finding someone that you're happy to chat to, that you feel safe talking to. And if that's your GP, it might be your Aboriginal Health Service, a public health nurse out in Kununurra. There's so many different people. It might be your midwife when you're pregnant. It might be that you talk to your teacher or your youth worker or someone in your world about it, and they might recommend someone. Often word of mouth's really important, and you'll have mates and family members that probably know where to go.
There's like a lot of stigma, there's a lot of shame around this topic. What is a way that we can move away from shame and stigma and more towards positive sex and positivity around this topic?
We do see a lot of campaigns get made. I think, yes, it's on us as community. Sometimes that can be tricky. In community, you don't mix women's and men's business. So sometimes it can be tricky to really normalise and advertise stuff because it always has to be in a really safe way. And I've done lots of women's health camps and activities and like amazing interactions that have been spoken in Narrandera in first language for people. So sometimes it can be tricky really to get that out there. But I think we do have to have those messages in that group work. I saw something about travel health and travel medicine. A lot of us go on holidays. No one talks to us about sexual health. Like before you fly out, do you need PrEP, which is a medication you can take to prevent HIV? I've had lots of guys come in to see me before Mardi Gras and after Mardi Gras. Like, I also think as a workforce, as health workers, we have to do better. We have to normalise it. Like you said, when you're coming in for your blood test or something, we have to, and I know we're under the pump. I know there's a lot of GPs that are struggling. But we have to do better at normalising the conversation, because I see a lot of clients that say, I wish the doctor brought it up. I won't talk about it unless someone asks. And then secondly, a lot of people have this assumption that when they get a blood test with their GP, that it's testing for everything. So I see so many people that are like, I just assumed I had a HIV test or a syphilis test because they took my blood last week. And I'll have a look and it's like, that was checking your kidney function and your liver function and all those things that GPs care about. But on the pathology form, it has to specifically say what tests need to be done. And so if we're not having that conversation, there's a lot of people walking around with the assumption that they're up to date, and they're probably not.
So if you went and got an STI test and then one of the test results came back, or one or more came back positive, what are the next steps?
So usually you'll be obviously notified about the results. So most people have a choice with how that happens, whether that's a text message, a phone call, an email. And so you'll come back into the clinic most often. And then that's when they'll talk about the treatment options. So whether that's tablets, an injection, those sort of things, and make sure it's safe for you to take those. And then also they'll talk to you about, it might be that you shouldn't have any sex until a week after you finish your treatment, for example. And that's because it can take time for it to be completely gone. We'll talk to you about contact tracing. So that means that if you have one of these notifiable infections like chlamydia, gonorrhea, syphilis, we'll talk to you about sexual partners from recently. So that might be the last 3 months or 6 months, depending on the infection. And we want to know about those people so they can be notified so that they get tested and treated. And that really is about stopping the spread and stopping more people getting something. That data goes to the health department, and that's because they're keeping track of these infections. Because if we weren't mapping these things and seeing those trends and the demographic data, then we don't know where to put our money and where we need to put staffing. And exactly. Yeah. So it's more about that stuff. It's not about, Googling your name and it comes up on a website. There's nothing like that happening.
Yeah.
Where is it that our listeners can go to learn more about STIs and raise awareness themselves?
Yeah, so the government has a website, health.gov.au/STI. So I think that's an excellent place to get information. Reach Out is a website for young people that has a page that talks about how do I talk about sexual health with my partner. So it just gives some tips and strategies about normalising that conversation. In every state, the family planning clinics, it's usually run by them. But if you Google sexual health helpline, for instance, in your state, there's usually a service where it's a phone service that you can phone, or it can be email or sometimes chat if they're that progressive.
Yeah.
And what that is you can ring and phone to a sexual health nurse, so someone that's trained in that area, and ask questions. Where can I get a test? Can I come see you? I've got these symptoms. Should I be worried? Those sort of things. And I find those services brilliant. And I've worked on those phone services.
Yeah. Thank you so much for coming on today, Cara. I've learnt so much.
Absolutely.
I feel like, in our friendship groups, we talk about STIs often, and I feel like we're really positive in our group, but I feel like I want, anyone to get to that stage where they can just be like, yeah, had chlamydia last week, went to the clinic.
It's so sorted. True. It's changed a lot.
Make STI testing sexy.
There's your new campaign.
I expect to see you on a poster now. Yeah.
There's your new campaign. But thank you so much, Cara. Yeah. We really appreciate your time. We really appreciate the work that you're doing in this area. And also thank you for your work that you've done in First Nations communities as well.
Thank you.
Thank you. I love my work, so thank you so much.
There is so much more that you can learn by going to health.gov.au/STI, not just from what we've been speaking about, but so much more on there about awareness, prevention and treatment.
And if you want us to cover anything on the pod, reach out via our socials. My handle is @Brooke.Blurton. Maddie's handle is @It'sMaddieMills.
Bye.
Bye.